my name is Stephen Guffey. I'm Associate Professor of Physical Therapy at Arkansas State University. And I want to share with you today a new product, a new technology for treating musculoskeletal problems. What I have is called a ThermoStim probe. The ThermoStim probe is a device that allows us to deliver heat or cold while we simultaneously deliver electrical stim through a probe which has multiple surfaces. It has a rounded flat surface as well as some edges that will allow us to do various techniques of soft tissue mobilization. Our patient today has a subacute to chronic low back issue. She has quite a lot of muscular tightness and even some adhesions in her paraspinal muscles from the injury that she suffered. She's basically chronically inflamed. She's not improving anymore. So what we're going to do is use soft tissue mobilization to try to kickstart her repair process by actually causing a small local acute inflammation. Now, she is connected with this electrode into an electrical stim circuitry. We're delivering the stim through the probe. We're using a biphasic waveform, and we have a pulse duration of 250 microseconds, and we're using about 5 pulses per second for rate, and then the intensity will be just at motoric, just slightly below motoric. So let me know when you can feel a thump. Okay. Good. All right. So we'll start there, and now we'll deliver the heat and the stim to the area of her paraspinal muscles from about the top of the sacrum up to the ribs. And as we introduce the treatment, the heat begins to take effect, the E-stim is starting to work. Then we're going to go to our areas of adhesions. We're going to move up on the edge of the probe and try to work out those tight areas. Occasionally we'll flatten that and smooth the area and then come back to our adhered area using an edge so that we can break up those adhesions. This is very comfortable. There is some pressure that I'm applying, kind of base that on the patient's tolerance, but we do want to inflame the area a little bit with the treatment so that we can restart the healing process. You want to be a little careful to avoid the spinous processes with the edge of the probe, and kind of the same thing over the PSIS. Staying in the soft tissue whenever we're applying pressure or using the edge of the probe. So we'll proceed with this, working on the tightened areas for about 10 or 15 minutes. And the beauty of this is we're combining the normal things that we would do anyway, heat, stim, and soft tissue mobilization, all in one treatment. When we've completed this particular delivery, doing various angles and techniques of soft tissue mobilization, we'll follow with an application of infrared light, or actually a combination of red and infrared light. We'll do that at about 9 joules per centimeter squared at any of the locations that we feel is the locus of her injury. So the ThermoStim probe, a combination of heat, stim, and soft tissue mobilization, very effective for the majority of musculoskeletal problems that you see in general practice.